More than 20 people in our state have died from flu-related illnesses. The surprising thing is the population affected. Most of the victims have been between ages 25 to 49. Dr. Kevin Campbell is here with more about keeping healthy this year. Good morning, Dr. Campbell.
Good morning.
Thanks for joining us. A hot topic here in our state. Tell us, what is the flu? What causes it?
So the flu is caused by a virus. It's the influenza virus. There's type A, type B, and what we hear about a lot is this H1N1 strain, which is particularly virulent or can cause significant severe disease.
And some of the symptoms are?
Cold, shakes, chills, high fever, runny nose, body aches, fatigue, malaise. I mean, you know when you have the flu. One of the hallmarks is a very, very high fever.
And more than 20 people have already died from this. Who are some of the people that are targeted, I should say? You
know, interestingly, we think of the very old and the very young and those with chronic diseases like heart disease, diabetes, high blood pressure, asthma, as being more at risk. However, in this particular year, we're seeing more young people, 25 to 50, have made up the large proportion of these deaths.
Okay, and also what about the strain of flu this year? A lot of people getting vaccinated. How effective is it this year?
So the vaccine is a very good match.
Okay.
It does protect us against the H1N1 strain, which seems to be the predominant strain in these deaths. Interestingly, I think a lot of young people are not getting vaccinated. And since they're not getting vaccinated, they are the ones that are dying from this flu. And the older you are, the more you've been around and been exposed to H1N1, so your body does build up some immunity over time.
I see. All right. So it's not too late to get the flu shot, right?
That's exactly right.
Okay.
Get a flu shot. If you have not had one, get it. Flu can last until May. It's rare to go that late, but it can. It's a severe disease. It can cause pneumonia, can cause death, particularly in those at-risk populations. If you get a flu shot, within 2 weeks, you'll be immune. It will be worth your time.
Yeah, definitely worth being safe. Dr. Campbell, always good to see you.
Good to see you. Thank you so much.
Yeah, and if you have a medical question for Dr. Campbell, go to WNCN.com, drkevincampbellmd.com, and you can also find him on Facebook.